Well, I'm glad you're videotaping then, because since they're not here to listen. My name is Mare. I brought a quick picture of my daughter to show everybody. I'm here to support age 24 and S61, which fund a program called CASTLE, which is the Center for Acquisition of Spoken Language through Listening Enrichment. And I'm not a huge fan of public speaking, but when you feel passionate about something, and I'm passionate about my daughter and I'm passionate about this program, I decided it's important to be here. So Allie's almost 5, and she has a very severe hearing loss. She wears hearing aids. She was diagnosed at birth. She got her hearing aids very quickly and a lot of good early intervention. She has some other special needs, some gross and fine motor delays, some sensory funky stuff. And when she was first diagnosed, I thought that she was going to have to go to some school, some boarding school across the state. We'd all have to learn sign language, and I was terrified. And then this CASTLE program that I was just talking about, and this bill is to help fund CASTLE, or to fund CASTLE. The CASTLE program in Durham, I learned about it, and the first thing that I did with the program was something called the Mommy and Me group, and that was just a special group for parents of young children with hearing loss. And then she went to their preschool, and the preschool is amazing. It gave her an intense language-rich environment. There's parent sessions, and basically what they try to do is train the parents to learn how to help their kids learn to listen and speak, to use an oral form of communication for deaf kids. So it's amazing. These kids are learning how to speak. They are going to mainstream schools afterwards, and that's my goal for my daughter. And they address all of her other special needs. They provide a lot of parent support, both formally and informally, just meeting other parents, and then also some special groups and conferences they have. And basically, it's not just about my family. I mean, it's changed our life. We are so passionate about the school, and it may lose all of its funding from the legislature, but they also do so much throughout the state. They provide conferences, they train students, they train other professionals, who give them expertise in what we call the auditory verbal method. They help schools throughout North Carolina, just about done. And they also just help other professionals so that all throughout the state, like the good work that they're doing in Durham, gets spread. And that's what's just so important. It's not just a program that's helped our family and saved us. It's just something that is so valuable throughout the state to work with these kids and to let them learn how to listen and speak. So we're hoping that it gets funded again. Okay, thank you.
My name's Susanna Birdsong, and I work for the North Carolina Coalition to End Homelessness. We're a statewide advocacy organization, so we are based in Raleigh but work around the state with folks who are homeless, folks who are vulnerable, and the people who serve them around the state. So when I saw the House budget last week, I knew it was going to be bad, but I had no idea that it was going to look as bad as it did. And the programs that are at risk for the people that I work with and for the people who are most in need. I mean, when we talk about downturns in the economy, those who have the least often are hurt the most. And so when I talk about the impact of what this budget could do to the people that I work with, it's real and it's devastating. In Health and Human Services, we're seeing drastic cuts in community support services for mental health and substance abuse services that are vital for the people who are currently homeless, who are at risk of becoming homeless, to get out of the homeless system and back into stability. In housing specifically, there's a program called the Housing 400 Initiative that's at risk. The Housing 400 Initiative was created to provide housing for those people who make SSI level income and below. So somebody on SSI is somebody who's permanently disabled, and that income level for 2009 is roughly $675 a month. So when you talk about housing for somebody who has an income of $675 a month or less, you're talking about housing that is really subsidized. We need state funding in order to build it and maintain it. And that funding is at risk right now for those folks. So we're talking about people who are currently in the shelters who won't have anywhere to move out to, who will be living in the shelters until 2014, until whenever we have a better budget year, if this program is cut right now. We have some federal stimulus money coming down, which we're grateful for, But that money is about $29 million over the next 3 years that's going to homelessness prevention and rapid rehousing. So it's really meant to supplement what we already have in our state and not supplant it. And so we're grateful for that funding, but we know that in order to maintain the level of services that we currently have for homeless folks in our state, and in order to make sure that we don't see more homeless people show up in our shelters and on our streets over the next few years, we don't need to cut these vital programs that are on the chopping block right now. So it's a pretty gloomy outlook, and I could be really depressed standing up here in front of you right now talking about it. But I was really energized yesterday because I attended the press conference that TogetherNC put together, and the momentum around the idea of building revenue, creating revenue in the face of, wrap it up, in the face of budget cuts, and this group of people from all walks of life kind of coming together around this one idea was really energizing. And so I just want to lend my support to the effort and say that while I could be demoralized, I am in fact energized right now at the potential that we have to do good.
I'm Laura Bono, Scott's wife and mom to Jackson. Scott mentioned about how important the CAPS program has been to my son. He's improved his skills greatly, and I think it's important that everyone realize when you hear about home and community support, and that can sound like, oh, well, you know, they're already at home. I mean, are they playing outside or something? And no, it's not. This is, imagine a child who likes the sound of breaking glass, so proceeds to break all the windows out of your home. Imagine a child who decides that maybe it would be fun to jump on the dishwasher and make it bounce, and so when he jumps on it, it crashes into the floor. Try the oven at Thanksgiving, crashing into the floor. Or, you know, anything that he eats that he's allergic to, he has massive diarrhea 10 times, you know, the entire day, and is hyperactive running through the house. And now imagine that that child is grown up and he's 20 years old, and he's about as tall as his dad and weighs 200 pounds. And he's running around in the house. And then you realize that one of us will have to quit our job. And then that means less tax revenue into North Carolina should we not have this after-school home and community care. And it has literally saved us from going crazy, you know, if you have that all the time, and just having someone there in the afternoon, because we cannot leave him alone. He needs 24/7 care. If that is cut, we have to decide, does Jackson stay with us and with his loved one, or does he go to an institution, which means that where are you going to put him? Well, we don't even have the institutions in North Carolina to put them anywhere. But if that's the case, and he goes to an institution, it will easily, quadruple, 6 times, 7 times? How much more would that be? Right now he is on our insurance, but he's got a lot of health issues, epilepsy, immune system problems. He's in and out of the hospital. That would go to the state. Right now we want to keep Jackson with us. We want to keep him with us because we love him so much and we want to take care of him. But if we can't take care of him because the supports are cut, then we all lose. We certainly lose. The state loses revenue, and hopefully with the skills that he's learning through the CAPS workers, he becomes even less of a burden throughout his lifetime. So that's it. Just don't force us to lose that home and community support. It's so important to us and thousands of other families. Thank you.